So the ImPrint signature was designed from the I-SPY trial, and the I-SPY trial is a really interesting effort spearheaded by a group at UC San Francisco that's really around the United States with multiple sites, and it looks at various novel agents given in the neoadjuvant setting for women who are predicted to respond to chemotherapy in that setting. And so they simply add various therapies to a baseline of paclitaxel, followed by adriamycin and Cytoxan. And so in this trial, they found several signatures that correlated, genomic signatures, RNA profiles, that correlated with response to various agents. And they found one that predicted response, that is, a complete pathologic response to immune checkpoint inhibitors. And it's a 53 gene classifier that they developed, and then that was applied to the FLEX database. So the FLEX database is a group of now 12,000 women who have molecular signatures on their primary breast cancer. And they will get a test called MammaPrint. It's a 70-gene assay that determines one's risk of recurrence, either low risk or high risk. And what we found in that particular study is that the women who were high risk, that hormone receptor positive, high-risk breast cancer, about 5% of those patients that were predicted to be kind of what were called luminal, high-risk luminal cancer, actually were predicted to have a dramatic or a substantial response to immune checkpoint inhibitors. With HER2 positive disease, or predicted HER2 positive, either hormone receptor positive or hormone receptor negative, those patients, I think, had about an 18 to 20% chance of those patients were predicted by ImPrint to have a significant response to checkpoint inhibitors. And finally, in the patients that were basal subtype, that is, even though they may have been hormone receptor positive, they still have characteristics of a basal-like cancer, about 60% of those women actually were predicted to have a substantial response by ImPrint to antihormonal therapy. And so this is really interesting because it now suggests that we may be developing signatures for response to immune checkpoint inhibitors in patients that are estrogen receptor positive, who we never would have thought would have responded. So this may open up at some point. I think there has to be more clinical trials, but it may open it up. Of interest, there's a trial of a novel immune checkpoint inhibitor that's from I-SPY that's being presented a few days later, I think on Friday. And in that study, it's interesting that the ImPrint signature predicted quite nicely, up to like 90% of the patients who were ImPrint positive had a complete pathologic response to this novel checkpoint inhibitor. So I think this signature does have utility. I think it's being refined, and we'll see what happens.